All right, well, whether you're dealing with sore and aching legs or if you're worried about varicose veins, our next guest can actually help you. Joining us now is Dr. Challa from Chesapeake Vein Center and Med Spa to tell us a little bit more. Welcome back to the show, Doctor.
Thank you for having me.
So, mostly women, but men too, they deal with these venous problems. Tell us a little bit more about it and varicose veins. Are they the same?
Varicose veins are a type of presentation of venous problems. Lots of people have leg swelling, aching, heaviness. In fact, majority of people I see have heaviness and aching, and sometimes men and women too occasionally present with big varicose veins. That's one segment of this issue.
When should people start realizing that they have a problem and they need to seek some kind of help about this?
You know, in your day-to-day life, if you feel that your legs hurt a lot by the end of the day, or your legs swell, you feel like you have to put your legs up by the end of the day, or you have big veins or some skin changes at the ankle, those are the types of things that should tell you that maybe this needs to be looked at by a vein specialist.
What kind of treatments are available out there? What can you help people with if they deal with those issues?
At the basic level, I'd advise anyone who's engaged in a lot of activity involving standing, etc., to wear some sort of a compression on their legs. I run, and when I run, I wear compression sleeves that really help, for example. But we have lasers, we have very non-invasive treatments, helped a couple of thousand people at least with these type of non-surgical treatments, should they need it. Not everyone does.
How would you go about diagnosing the issue?
Are you aware of an ultrasound, the non-invasive test women get when they're pregnant? So we have a version of that that checks the leg veins, so we can easily do it in about 45 minutes.
So you're getting a very accurate diagnosis. You're not just thinking, oh, I have a problem and...
Well, as I was saying, as soon as I lay my eyes on someone, with the experience we have, I can tell. But the confirmation is always with an ultrasound that either proves or disproves it.
And again, what type of improvements do your patients report seeing after they've had the treatment that you're recommending?
You know, and I'll go back to my website, Chesapeake Vein and Med Spa. There's a testimonial page full of people who kind of detail their improvements. Majority of the time, what I hear is this non-specific type of feedback saying, "Doc, my legs feel so much better." Or people say, "My legs don't hurt anymore, they don't swell anymore, thank you, I can walk 2 blocks," things of that nature. Tell me, you know, you do a really good quality of life improvement day to day.
And it's not just something that affects older folks. I remember in my 20s, I started getting this random swelling in my ankles. So should people always be looking at their health and, you know, looking for changes in their body?
Truly, that is correct. Every decade this progresses because the causes are genetic. The manifestations come on with your type of lifestyle you lead, but it's genetic. So women in their 50s, for example, may have a lot more of these than women in their 20s, but certainly it's a good time to look down and see what's going on.
What's going on with your body. Thank you so much for coming onto the show this morning.
My pleasure.
And we want our viewers to know where they can learn a little bit more about Dr. Challa's treatments at Chesapeake Vein Center and Med Spa. They're located at 300 Medical Parkway in Chesapeake. Give them a call, 517-3297. You can also go online at Chesapeake Vein and Spa, veinandmedspa.com. Thank you for coming onto the show.
My pleasure.